Why do you still feel so anxious, even though the worst is over? Why do loud noises or sudden changes feel like a danger? Why do you avoid things you used to enjoy? These are questions many people ask after going through something really stressful. Hi everyone, I'm Dr. Katia Batista. In this video, we are going to break down what happens in the mind and body after trauma. This is a continuation of the serious trauma, but in this chapter, we will explore the difference between acute stress and post-traumatic stress disorder and how to recognize when your nervous system is still stuck in survival mode even when life have moved on. Please stick around because understanding this might help you finally make sense of what you have been feeling. After a very difficult or frightening event, it's normal for your body and brain to react strongly. You might feel tense on edge, have trouble sleeping, or get emotional easily. This called acute stress and is your system trying to protect you and recover. For most people, these symptoms gradually improve within few days or weeks. It's like the body is saying, that was a lot, I need time to process. But sometimes those reactions don't go away or even get worse. Now, let's take a closer look at the symptoms of post-traumatic stress disorder, PTSD. Sometimes we talk about these signs so generally that people either don't relate it at all or they think everyone has PTSD. The truth is, these conditions have specific patterns. First, PTSD doesn't come from just any stressful experience. It usually follows something that seriously threatens your life or safe, like surviving an accident, being in a war, going through physical or sexual abuse or violence, or witnessing something deeply disturbing happen to someone else. It's not about hearing upset news or going through a breakup. It's about real or perceived danger that overwhelms your ability to cope. One key symptom is avoidance. And this is not just avoiding thinking about it. It could be staying away from certain places, people, conversations, or even sounds and smells that remind you on the event. Sometimes people avoid feelings altogether. They disconnect emotions just to get through the day. Another major symptom is re-experiencing the trauma through flashbacks, where it feels like the event is happening again, or through nightmares, intrusive thoughts, or strong emotional reactions that seem to come out of nowhere. You might also notice changes in how you react to the world. Maybe you are constantly on edge, easily startled, or unable to sleep well. Some people feel numb, like they have lost interest in things or feel detached from others. There is also a shift in thoughts and mood. You might struggle with guilt or shame, or feel like you cannot trust anyone anymore. And often people stop believing that the future can be good. All of this can make daily life exhausting, not just emotionally, but physically too. You might also experience emotional and cognitive changes that are not always easy to notice at first. Some people become extremely sensitive. Small feels feel overwhelming. There can be a constant sense of tension, like you are always waiting for something bad to happen. This can lead to irritability, anger, outburst, or even shut down emotionally. Others may struggle with distorted thoughts like blaming themselves for what happened. Even they have no control. It's common to hear things like, I should have done something like this and this, or it's my fault this happened. These thoughts can become automatic and very painful. Another key sign is exaggerated startle response. Maybe a loud noise makes you jump, or you get tense in crowded places. This hypervigilance can be exhausting because your body feels like it's always in survival mode. These reactions can impact your work, relationships, your daily life, even if you are trying to hide it. We as professionals use the DSM-5 criteria to diagnose post-traumatic stress disorder, but even without a diagnosis, your experience is valid. If your body and mind are still reacting to something from the past, that matters. Here's the most important part. Post-traumatic stress disorder is treatable. You are not broken and you are not alone. So you can actually recover from it. There is not a one-size-fits-all answer, but the good news is there are evidence-based treatments that work. One of the most effective is trauma-focused cognitive behavioral therapy, where you learn to understand and reframe those thoughts and beliefs connected to the trauma. Exposure therapy is a type of cognitive behavioral therapy that helps people face the memories, situations, or this that he has been avoiding because of trauma. The idea is that by gradually and safely exposing someone to what they fear, their brain learns it's not as dangerous as it once felt. It can start with imagining the event, talking about it, or visiting certain places with support. Over time, this helps reduce fear, anxiety, and even the flashbacks. It doesn't erase the past, but it makes it feel less overwhelming. Eye movement, desensitization, and reprocessing. EMDR is a therapy that helps people process traumatic memories in a different way. Instead of just talking about the trauma, the therapist guides the person to focus on it while doing eye movement or tapping. This helps the brain reprocess what happened so it feels less painful and less present. Many people say that after EMDR, the memory is still there, but it no longer feels as intense, or triggering. If you want to know about how this therapy works, I invite you to find previous videos of my trauma series where I explain in detail this kind of therapies for you to better understand. Medication can also be part of the treatment plan. Antidepressants like SSRI can help with mood, anxiety, and sleep issues. And also we prescribe prazosin. It's a medication that has shown effectiveness in reducing trauma-related nightmares and improving sleep in people with post-traumatic stress disorder. It's not for everyone, but for those who experience intense nightmares, it can be a meaningful part of the recovery. As always, medication decisions should be made together with a healthcare provider who understands your full picture. Healing is not linear, but with right support and tools, you can move forward. Sometimes when you are dealing with trauma, the hardest moments come unexpectedly. Like when a memory pops up out of nowhere, or your heart starts racing, or you don't even know why. If you have ever felt overwhelmed, disconnected, or like your body is on high alert for no clear reason, approach a mental health provider. In those moments, it's important to have simple tools you can turn to, things you can actually do to calm your nervous system. What matters is taking the first step, recognizing what's going on and reaching out for support. Please, if this video helped, if something clicked for you, or gave you language to describe what you have been going through, subscribe to this channel. Here we talk about mental health in a real, respectful, and accessible way. Leave a comment below if you have experienced something similar or want to share your thoughts. Someone else might need to read exactly what you have to say. Thank you for being here.